COVID is a challenge for CAR T cell patients because just by the logic, a lot of our CAR T cells that we're using, CD19 CAR-T cells, lead, of course, to a B cell depletion, and a B cell depletion creates a situation that we are not really able to generate serological immune responses as we do this in other patients. So we cannot that easy protect this group of patients. So from the limited knowledge we have, we see that these patients do not generate serological conversion in the presence of B-cell aplasia, which is not surprising. We are hoping for some T-cell responses that protect the patient nonetheless. Whether frequent vaccination can overcome that problem is also not known. When we are looking into the outcome of our patients that caught COVID after a CD19 or BCMA-directed CAR-T cell therapy, then we see a significant mortality in these patients, and that requires our attention to these patients. What can we do with them? Well, first of all, we can try to protect them from COVID by isolation or by behavior, and that worked very well until Omicron came. But Omicron is, of course, a new challenge because not fully covered by the vaccines, and being much easier to spread between individuals. So these patients need our attention when they have COVID. We need to really consider monoclonal antibody therapies and or antivirals at a very early stage to make sure that we protect them. Prophylactic infusion of monoclonals is certainly a possibility as well, but so far we have a shortage in this Omicron wave of all these drugs, so it is not easy to handle in reality. But COVID-19 is definitely a challenge to the B-cell directed CAR-T cell treated patients, and it needs to be handled with a lot of caution and respect.